This week on Healthy Living, the World Health Organization has declared the mpox outbreak a global health emergency. And Dr. Sam Boland, WHO Africa Acting Incident Manager, discusses efforts to contain the mpox epidemic that is spreading around the world. Plus, the US faces a summer surge of COVID-19. Finally, a public health expert shares some tips to address the resurgence of outbreaks. That's in this edition of Healthy Living. Hello, I'm Linor Moudou. Thank you for joining us for another edition of Healthy Living. The World Health Organization has declared the ongoing outbreak of mpox in Congo and elsewhere in Africa to be a public health emergency of international concern. It is the highest level of alarm issued by the WHO and the second time in 2 years for mpox. This week, the WHO says there are cases of mpox in more than 15 African countries, as well as Sweden, Pakistan, and the Philippines. As the world battles the mpox virus, observers say the surge is exposing the world's most vulnerable. According to UNICEF, children are at significant risk, and the new variant adds extra burden for families living through conflict and displacement. Vincent Makori has more.
Justine Munguiko could not recall the name of the disease she had been warned about. She just knew her baby was suffering when sores appeared on its feet and hands like other children at the displacement camp near the eastern Congolese city of Goma. Communities like Munguiko's are among the most exposed and in need of support. She and other mothers at the camp decided to treat their children a traditional way for dealing with fevers and rashes, washing them in boiled salty water and rubbing their skin with the soft leaves of kitamatama plant.
This skin lesion disease comes from I don't know where. I can't even remember the name of the disease. We were told that it comes after eating game, but neither I nor my child have eaten game. These symptoms just appeared.
As the international community scrambles to source enough vaccines, Munguiko's experience highlights the amount of work that needs to be done to make sure the most vulnerable in Congo and elsewhere have the right knowledge and resources to protect themselves from the viral infection that is usually mild but can kill. Communicating with people about what they should do is critical.
We need to get the right information out to the people who are immediately at risk, as well as those who are likely to panic. Communicating with people about what they should do, what they should report, and how they should report so we can understand what's going on quicker and contain it better is critical. But long term, so that we don't have the same conversation again next year, the year after year, we need to ask ourselves, how do we define public health emergencies of international concern? When do we define them of international concern?
There have been around 27,000 cases and more than 1,100 deaths, mainly among children in Congo, since the current outbreak began in January 2023. The virus has also spread to nearby countries. At Kinyarushina camp on Monday, residents gathered in an open area between the rows of tents to hear a health worker from aid organization Medair explain how to avoid infection. They received a colorful leaflet with pictures showing the risk of close contact with infected animals or people. The challenge in Congo and other African countries is compounded by a lack of funding for research.
The first time mpox was identified in countries was, in fact, in Central and West Africa in the 1970s. So 50 years on, there has been a shameful lack of investment to support researchers in African countries to really understand mpox better. We still globally do not have a good understanding of mpox, on the outbreaks, how it spreads, how many asymptomatic cases do we have for every case that we find with symptoms. We do not have a good understanding.
To effectively protect against mpox, the WHO has initiated an emergency use listing procedure, EUL, to help countries with regulatory reviews of mpox vaccines. It also enables UNICEF as well as Gavi, the Vaccine Alliance, to quickly procure vaccines, speeding up the process of getting safe and effective vaccines into the right hands. Vincent Makori, VOA News.
Dr. Sam Boland is the acting incident manager at the WHO Regional Office for Africa. He discusses the dangers the new mpox variant posed globally and what is being done to contain the epidemic.
The response to mpox in the African region has already very much been ongoing. So both in countries that are actively affected as well as in countries that are at risk, the World Health Organization has been working with ministries of health and member states, as well as coordinating partners, to be sure that we're already actively responding to this particular problem. The declaration of a public health emergency of international concern that was made by Director General Tedros earlier this evening really serves as a call to action to the global community, which can have a lot of positive consequences for our ability to effectively respond to the crisis at hand. So in addition to all of the work that was already ongoing, what this means is that we can work with the international community to make sure that we have the resources available to respond. And the World Health Organization has been supporting countries in the African region, for example, South Africa, to be sure that they're able to access doses of this very novel therapeutic to be sure that people are able to get the clinical care that they need. And this is a very difficult process, and it's the same process that is true for vaccination, which is that really one of the barriers is a regulatory one. We have to work country by country to be sure that countries are able to import and then put to use something like the therapeutic that's available, or in the future, the vaccinations that we may be able to roll out. Sometimes, depending on the country or specific outbreak we're talking about, it is possible to identify a patient from whom we think the first case was communicated from what we call the animal reservoir. In the case of the outbreak in the Democratic Republic of the Congo at this moment in time, however, really we're talking about cases that are being communicated between one person and another person. As the WHO ourselves and under the international health regulations and our emergency response framework, we work very, very hard to be sure that we're in a position to support coordination between all partners, including the Africa CDC, but also including other UN agencies such as UNICEF and other INGOs and the like, to be able to ensure there's a harmonized, synergistic, and coherent response to this particular crisis at hand.
How concerned are you about the spread of mpox in your country, and what do you think should be done by health authorities to protect people from the virus in your community? Here are some reactions from Nigeria.
Monkeypox is a disease that affects human. Yes, I'm so concerned about the disease because it's a great, it's a public health challenge. So therefore, we have to work together to avoid such. As such, we don't have to eat animals like rabbit, monkey, bats, etc. So any of those animals. Like myself, I'm from Benue State. In my state, we eat a lot of meat. So when you go there to tell them, oh, don't eat this animal, don't eat bush meat, they'll be so angry. So the government have to go out there to sanitize the people, and also they have to make a program to educate the people, even in school.
Based on my knowledge about this monkeypox, is a disease that used to transfer from animals sometimes to human beings, and it causes some rashes and all these unwanted spots on the skin. To me, it's real. I believe in any disease that I hear about it, even if I don't know or meet with somebody that is affected with that kind of disease.
It's a new developing disease from I think it's from other country, but it's not yet in Nigeria, and it's from animal to human. I will prevent myself by not eating any kind of meat, like especially those meats that we don't know about.
Okay, I really don't know much about monkeypox, but the little I've heard or I know about is actually a very deadly disease, right? So I think it's being transmitted from animal to humans. based on bushmates or stuff like that. Yes, I'm very concerned because we just stopped dealing with COVID and we're having another disease again this year. And so I know most of Nigeria, we love eating bushmeats because I think it's from there, right? So, and since we love eating bushmeat, so it's very quickly that it can be transmitted. Health comes first. So we just need to stop eating things that are not good to our health.
A surge in COVID-19 infections has swept the United States this summer, and experts say it shows no immediate signs of dissipating. The U.S. Centers for Disease Control and Prevention tests the water from wastewater or sewage to see if there are traces of COVID virus within a community. Data collected earlier this month shows that 27 states have reported very high levels of wastewater viral activity nationwide, much higher nationwide than they were this time last year. Experts say the virus is mutating into new COVID variants. So far, these variants have not proven to cause a more serious illness, and COVID vaccines remain effective. The CDC is now classifying COVID-19 as endemic, meaning the disease remains at a consistent level within a region with predictable rates of infection, making it easier to control its spread. Dr. Muhumuza Umar is a public health expert with the Africa CDC and a Yali Fellow. He discusses some reasons for the reemergence of virus outbreaks such as mpox and what can be done to stop the spread.
The reason why we have re-emergence of diseases like mpox lies in about three reasons, right? The first reason is, do we have enough vaccination for mpox on the continent, right? Because one of the ways to reduce diseases like COVID-19 in the past was through vaccination, and we create something called herd immunity. As we speak today, we still face the challenge of vaccine inequity. So we have a lot of vaccine inequities on the continent. Even while we have announced it as a public health emergency, we do not have enough vaccines to vaccinate people or people at risk, right? That's the biggest challenge. Secondly, are we following the One Health approach to addressing critical epidemics like mpox? You see, the One Health approach is one that looks at how people engage with animals as well as the environment, right? Now, we have had people encroach onto the natural ecosystem. So when I say encroaching into the natural ecosystem, you have people going into the rainforests, and now they are interacting with potential carriers of the mpox, the monkeys and the rats, right? So it literally means that we need to employ a One Health approach that looks at both human, environment, and animal health. But then lastly, we need to talk about the question of risk communication. But risk communication is very key because you recognize that we have mpox and it's been declared as a public health emergency on the continent and globally. But when you go through the internet and everything, there's a lot of mis and disinformation regarding what mpox looks like, right? No one seemingly believes that mpox is actually an emergency, right? And you will have people who will be against the mpox vaccine like they've been against the previous vaccines like COVID, right? So we now need to employ a mechanism to address the mis and disinformation. The misinformation does not stop there. We need to create trust in the system. Most Africans do not trust that their governments can actually deliver a good public health response to an epidemic like mpox, right? So through leveraging things like social media, we need to change the narrative.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at Linoch Mudu. Until next time, stay well and strive to make every day a healthy day.